Well, joining us for CHI Memorial is Dr. Jaime Ponce, and we are talking about Obesity Care Week. And we've talked a little bit earlier in the show about the epidemic of obesity in our area. So here to give us some details and some options is Dr. Ponce. Good morning.
Good morning.
Thanks for joining us.
Thank you.
All right, so talk to me a little bit more about Obesity Care Week and its impact here in the area.
Correct. So this week is called the National Obesity Care Week. So we're trying to create awareness not only about the problem of obesity, but also about the treatment options that are available. Obesity is becoming very prevalent in the United States. You know, over 39% of the adult population in the United States is considered to be obese. And, you know, obesity doesn't come without consequences. There's a lot of medical problems associated. Some of those have you heard. People have heard about type 2 diabetes, high blood pressure, sleep apnea. And also the social implications, you know, it's more difficult to do outdoor activities. You know, disabilities are more common. Healthcare costs increase. So all those problems are carried with obesity.
And one of the questions that I hear a lot in doing some research or items like that, watching the news, is obesity considered a disease?
Correct. So for the most part, when people start gaining weight and maintaining that weight over time and becomes more of a chronic problem, it is considered a disease. The American Medical Association has declared obesity as a disease because it's a complex feature that includes a lot of problems not only with gaining weight, but also the medical implications and metabolic issues. There are some people that have the genetic predisposition to lower their metabolism, to you know, store more calories. And those people, even if they keep trying and trying to lose weight, it's going to become more difficult. You've seen families that most of the family members are overweight or obese, and they have more difficulties to lose weight than some other families.
Absolutely. And we hear all the statistics of 39% are obese, and we hear that this is a problem, but what we don't hear about is our options. So talk to us about our options.
So there are different options, you know. For the people that are very severely obese, you know, people that have more than 100 pounds above their ideal weight, you know, surgery has become the mainstay in treatment. You know, that's the best therapy. It has become very safe. You know, have heard about gallbladder surgery, very similar risk to gallbladder surgery. But the surgery, what it does to these patients is not only make their stomach smaller, but it also changes their metabolism, decreases their hunger. And so that tool, in association with nutrition, psychology support, exercise, all that involves good outcomes for those patients.
So the surgery with the lifestyle change.
Yes.
And so then talk also about some of the other ones that maybe are not quite severely obese, but are borderline.
Correct. So for people that are not that severely obese, you know, in between 30 to 80 pounds above their ideal weight, these people have tried different diets, behavior modification, Weight Watcher, Janie Craig, medications, and they continue to gain and not being able to maintain that weight, and they're already struggling with some medical problems. There are some non-surgical options. You know, we have some endoscopy therapies. Those are done not by surgery, it's under sedation. And one of those that we use now is the balloons. You know, we put a balloon through the scope in the stomach, inflate the balloon there with fluid, and keep it there for 6 months. So what the patients do during those 6 months, they follow with a dietitian and exercise support. And they actually have to follow a diet and exercise support, but then during that time, feeling fuller with the balloon, they lose more weight.
Perfect. And then that's kind of ingrained in their habits at that point moving forward. All right, so how do we need to get started? If someone at home or a family member is in the obese category, what do they need to do?
So I think the first option is just to realize that they have a problem, that they have tried, that they cannot sustain a good weight loss, so they need to call our office or visit the website, and then we have free seminars. You know, they can come to a free seminar, we talk about all the options, and if they're interested, they can come even to meet patients that have had surgery or have had a balloon, support groups, and all that makes them more involved and interested in the options.
Perfect. Well, Dr. Ponce, thanks for joining us and helping us shed a little light on this for this week, Obesity Care Week.
Thank you.
All right, we'll be right back.